Millions of people across the U.S. are suffering from it. Chances are, though, you've never heard of it. Sometimes in the news business, those of us in front of the camera are able to shed a little bit of light on things that otherwise may stay in the dark. Because I have the disease that we're talking about, celiac disease. Along with my 5-year-old son, I am going to take advantage of that opportunity today. Once again, it is called celiac disease. It hits about 3 million of U.S. people right in the gut. That's 1% now of the U.S. population. It is a digestive disorder that's triggered by eating foods containing the protein gluten. That's right, the stuff of bread, pasta, beer, so many other things that we love to eat. Today, some answers. We brought in the director of the Celiac Disease Center at Columbia University, my physician, Dr. Peter Green. Dr. Green, thanks for being with us. We are talking today on the heels of the International Symposium on Celiac Disease that I was able to attend in New York. How many people did you have there?
We had over 1,400 people, Heidi. It was terrific.
What does that say about the number of people who are learning about this disease and physicians who are able to start testing for the disease?
It says that there's increasing awareness, but the disease is grossly underdiagnosed in this country compared to every other country in the world, because most of the doctors don't realize that it's 1% of the population.
And you and I have spoken before about what that percent is. I remember way back when we were all learning about our cholesterol. Everybody knew their cholesterol level, and it's the same percentage of people who have high cholesterol. You still say 98% undiagnosed, though. Tell us what the disease is.
The disease is a sensitivity to gluten, Heidi, which is the protein component of wheat and other grains, mainly rye and barley. In that condition, people get a reaction in their gut, but the manifestations affect almost every system in the body. The nervous system, the skin, the teeth, as well as the liver and the heart even. So it's very common, and the manifestations are very diffuse, which is one of the main reasons why it's so underdiagnosed in this country.
Tell us exactly what happens, Dr. Green. If you are a person with celiac disease, you don't know it, you consume gluten, you feel what?
Many people for long periods of time have no complaints. The most common complaint is diarrhea, but in adults it can be manifested as anemia, osteoporosis, various neurological problems, or even just fatigue or infertility.
If you do not take gluten out of your diet, what can happen to you? There are a lot of people who cheat even once they find out they have celiac disease.
That's right. You know, compliance with this gluten-free diet is very difficult in this day and age. Some of the long-term side effects include the development of various malignancies, including non-Hodgkin's lymphoma, which can occur in up to about 5 to 6% of people who have this condition.
I want to go ahead and take a moment to show a picture, Dr. Green. This was something one of your colleagues, one of the physicians, used during the symposium. This is a picture of a young child lying in a hospital bed. Tell us exactly what we're looking at here. This is the before picture.
That's right. Celiac disease is very common throughout the world, Heidi, and it's actually exceptionally common in these refugee camps in the Sahara in northern Africa. And this child looks like she is suffering from severe malnutrition. But the malnutrition in her case is due to celiac disease. So this is a very classical appearance, one that we don't see that often now in the developed world. But in the developing world, where wheat is being delivered as part of the refugee system, this child is actually suffering from celiac disease.
It's incredible to look at the after picture, the picture of the same child after gluten was taken out of the diet just 6 months later.
I know, it's truly an amazing picture, and we don't usually see this now in the developed world, but this is a tremendous example of what can happen. The disease doesn't appear to be as a major pediatric disorder now as it is an adult disorder, but this is an unbelievable example of how it can afflict people. And still, even though it's not common, we can see children like that in the U.S. It's truly quite astounding.
I want to get to some of these emails, Dr. Green, that we have here. Quickly, just want to say a couple of things to hit on here. I'm talking about what gluten is. This is a protein that contains wheat. So when people who have celiac disease consume wheat, barley, or rye, we're talking about cereals, we're talking about pizza, beer. I mean, we could go on and on with the things that poor people like me can't have. But there are so very many things we can have. I always say from the animal to the plate, from the garden to the plate. And these are where some of these questions begin. So let's look at something here from Gregory, Alexandria, Virginia. He says, if you have allergic sensitivities to gluten, does this mean that you necessarily have celiac disease?
That's right. There's a lot of misconceptions, Heidi, about what the term actually involves. Celiac disease is not a true allergy. It's actually an immunological reaction, but it's not an allergy. An allergy is something where you get hives or your tongue swells up. But many people, to convey the sense of the urgency that they need to avoid these products, claim it to be an allergy. People who are truly allergic, get hives with wheat, don't have celiac disease.
Okay, interesting. And quickly to point out, one crumb of bread, I always say, does the same amount of damage to me as an entire loaf. So we talk a lot about cross-contamination issues, too, especially in restaurants. Here now is the next one, because you talk so much about misdiagnosis. This person, B, says, I have been diagnosed with Crohn's disease and have had it for 20 years, but when treatment after treatment does nothing, I read more on celiac disease and see that there are a lot of similar symptoms. What can my doctor look at to distinguish the two, and how can I talk to him about trying to determine if we should be treating celiac disease?
That's a very good question, Heidi. We actually demonstrated that celiac disease occurs more commonly in people who have Crohn's disease. So there are a number of points. One, they can be misdiagnosed. Patients with celiac disease get labels of Crohn's disease, inflammatory bowel disease, irritable bowel syndrome, and they can have many, many years of symptoms before they actually get diagnosed with celiac disease. The diagnosis, Heidi, is actually very easy. It requires a blood test and an endoscopy. The difficulty with the diagnosis appears to be doctors considering the diagnosis.
Right.
Because once it's considered, it's easy. But unfortunately, it's not on the radar of most doctors, especially gastroenterologists and especially inflammatory bowel disease experts.
All right, so we have our work cut out for us. We're going to be screaming here about it. One left to talk with you about. When a person with undiagnosed celiac disease has suffered from malabsorption for a few years, is there a possibility of permanent damage done to systems and tissues because of the lack of nutrients? This is from D in Virginia.
Yes, there is. You know, one of the common manifestations of celiac disease are these dental enamel defects, the little spots that people have on their teeth, or the corrugations or dark marks or white spots. So they're obviously permanent damage that was created very early in life, in the first 7 years. But most of the manifestations of celiac disease, the anemia, the osteoporosis, will improve. The stunted growth in children will improve, Heidi, once the diagnosis is made and the diet is commenced. About 80% of people recover dramatically. Often the fatigue goes away. The improvement can occur within weeks of diagnosis.
All right. Well, we will continue to work on this together, Dr. Green. For more information, Dr. Green's website is at the Celiac Disease Center.org. Once again, that's Columbia University Celiac Disease Center. And if you'd like to do a symptoms checklist, you can go to the website for the National Foundation for Celiac Awareness. That's celiaccentral.org. Dr. Peter Green, thanks for your time.
Okay, let's take you now to Washington.